Hello there. Hi. Hopefully you can hear me. If you can't, please do let us know if anything kind of doesn't look right or doesn't sound right. But I'm just here. So I'm Liam Briley. I'm the outgoing chair, I suppose, of the RSS Merseyside local group. And before we started today, I guess I just wanted to thank everybody for those that have attended our events. And I do hope you're going to continue supporting the Merseyside local group in the near future. And I'm going to pass you into the very capable hands of our new chair, Dr. Gareth Lou Evans.
Thank you, Liam. I'm going to try to be a good replacement, Liam. Yes, so thank you for joining us for this event. Just make this full screen. So air quality, pollution and health, obviously very important topics. The very air that we breathe seems important to all of us. Really look forward to hearing what our speakers have to talk about today. This is the schedule. We start with Paul Fawkesley, climate campaigner, who talk about campaigning with data. He's the founder of the Clean Air Initiative in Liverpool. Then we have Dr. Sepeedeh Saleh from the Institute of Population Studies in Population Health in the University of Liverpool. A refreshment break, and then we have Dr. Craig Anderson, Senior Lecturer at University of Glasgow, and the current RSS William Guy Lecturer for 2023-2024. That's what we have today. We are also going to have some interesting upcoming events. Not necessarily all of these, but you know, we have a selection here. We'll probably have 2 or 3 more events in the year. The electoral and polling statistics event, we're going to try to time around the time of the election. It's quite a challenge. And we're all very much looking forward to advent of code and all the statistical programming daily puzzles. So this will be more like in November, December. So to find out about those events and keep it, informed about what we're doing, we have these various methods. So we have our newsletter, we have our Twitter page, and our YouTube channel. And also the Royal Statistical Society does have events outside of the Merseyside local group. You can find out about various things the RSS is doing generally. A big one is the annual conference, so in September. Finally, please consider joining the Royal Statistical Society. You don't need to be a full-time statistician. If you're generally interested in data and statistics, it's a community of like-minded people, and there are lots of events, and you can really get involved.
Right, I'm Sepeedeh. I'm a public health doctor and a researcher in Liverpool. I'm based at Liverpool now, but actually the work I'm going to talk about was done whilst I was at LSTM across the road, and physically in Malawi, which is quite a different place. So this is essentially the work that I did during my PhD, and there was a lot of different elements of that. I'm going to try and focus on the monitoring and statistical parts, but it's kind of couched in a wider set of research that I thought would be interesting to talk about. So just as a bit of background, as I say, I'm a specialty registrar working in public health, but my research interests are quite wide, and they span qualitative research as well as quantitative research. My PhD project essentially started with me hearing about a large cluster randomized controlled trial of cook stoves in Malawi, and wanting to know more about air pollution in Malawi and what it meant for people and how it sat in the wider context of people's lives really in Malawi. And it involved me living in Malawi with my family for 2 years, which was brilliant fun for me. And getting to know Henry, who was my research assistant, who's Malawian, and absolutely none of this could have happened without Henry. So I'm not going to talk too much about this, just to say that we know that air pollution is associated with a huge mortality and morbidity burden worldwide. That the numbers are about 7 million, but these keep changing depending on what you put in your model. And there's some evidence that around 94% of this happens in low and middle income countries. So it's a massive health equity issue as well. And Malawi is one of those, it's classed as a very low income country. And what we know as well is that whilst we have air pollution everywhere and high levels of air pollution in many, many different contexts, the sources of that pollution and what it looks like vary a lot by context. So Malawi is a very rural country, particularly for this day and age. So most people live in villages, and predominantly people are cooking with biomass, with mainly kind of firewood, basically. And then there's also the air quality and the climate link. So these, when we burn stuff, the products of combustion, they're driving climate change. And then therefore, the upside of that is that when we act on air pollution, we're acting on climate change as well and benefiting the environment. So it's an important issue. Okay, so the whole of my study, it had two kind of phases. The main bit was phase 1, and I wanted to get this wider and deeper understanding about air pollution and how it sat in Malawi and in people's lives in Malawi. And this involved something called ethnography, which I'll say a few words about later, but involved quantitative and qualitative methods alongside each other. And I think some of this is going to be about explaining how those two can be complementary and how useful it is to bring them together. We then did some participatory work to develop with people. I wanted this clean air intervention. It's going to change everything for people living in Malawi. And then the second phase was about essentially evaluating this in a kind of realist evaluation. This is how some of the methods sat together. I don't think it's too important, except to say that essentially we did this participant observation staying with households for a number of weeks. And then at the end of all of this, we spent some time around the village more generally, just doing wider observation. During this time, we did monitoring on our own, and then we also did interviews. We did a whole host of different methodologies. The core of this was ethnographic. I feel I'm departing from the Royal Statistical Institute here, but if you bear with me for a minute, ethnography means study of people, and it's about getting to know people within their social and environmental, their wider lives. And what I essentially did was this participant observation. I kind of lived alongside people for a number of years. It was mainly cooking. I did a lot of cooking and making fires. That's me dishing out the enzima that I made. And I also did quite a lot of early morning farming and going to markets and carrying water. Those are the main things that I actually did. Alongside a lot of this, we did air quality monitoring using different monitors, which I'll talk about later. We also did interviews at the end of each kind of few weeks stay in a house. We interviewed people to triangulate that data a little bit, and then we did these participatory workshops. So this is the air quality monitoring bit. We did two bits, really, two components of this. Initially, we got this descriptive data set, and what we're doing, we're using this white thing, which is the purple air. It's just a portable PM2.5 monitor looking at fine particulates. And me and Henry, my research assistant in the picture here, carried these in homemade kind of bum bags with little holes at the bottom. And we carried that throughout our participant observation. And whilst we were carrying it, we tried to very closely shadow what people in the house were doing. So I was the woman, I was doing the cooking and that sort of stuff, cooking, making dinner. And he was the man, and he'd hang out with the men who were in a different place generally. And this, compared with these, together with these really detailed field notes that we're taking all the time, gave us some really interesting insights that then informed the next bit, which was this more standardized data set, which gets a bit closer to what a lot of people might be more familiar with and might kind of expect a bit more. So at that point, we gave these monitors both the purple airs for the fine particulates and these little pen things, which were lascars that we used for carbon monoxide monitoring. We gave those to a number of residents across the village and got them to do 2 24-hour traces with these, carrying these monitors around. So that was their personal exposures throughout 24-hour periods. And the PM 2.5 monitoring was sampling every 2 minutes, and the carbon monoxide was actually every 1 minute. So we got kind of loads and loads of data points. And at the end, to look at activity at the end of each 24-hour period, we had interviews with participants, and we went through and looked at what their activities were throughout that period. A word on analysis. So we analysed it by time, day and night, and also by activity. Just to say now, a huge majority of what we're picking up on the monitor was cooking. The combustion activity was basically cooking. So we looked at cooking, and in terms of cooking, we looked at where they were cooking, what device they were using, and what fuel they were using. And within these categories, we looked first at the means and interquartile ranges, but then we also did a bit of regression using mixed models to try and tease out what was shaping those different exposures. We also did a bit of work looking at the PM 2.5 and carbon monoxide together to see how well they correlated. And going on initially to the results here, we ended up with 831 hours of paired data from 20 participants. And this is essentially what we're seeing in our traces. So what you can see is the baseline and the peaks pattern. And the baselines are actually quite low, impressively low. So this is fine particulate, this is PM 2.5, and you see the really low baselines, and then every time something happens, something being cooking, you see these really high peaks. And the interesting thing here is that the lower trace is from Henry, the man, and the higher trace is the same time from me, the woman. And we're seeing the same peaks, but whereas they were quite high, I mean, they were alarmingly high for Henry. They were going up to 500-600, which is worrying. In the woman trace, they were going up to 3,000, 4,000, 5,000, 6,000. And really funny, when I first got these traces and sent them back to my supervisor in the UK, we had a lot of conversations about risk assessment and whether I should just stop it now and come home, because it's actually really dangerous and the university wouldn't like it. So these are ridiculously high levels. And you can start to see why here. So every time the women were doing the cooking, and cooking really meant kind of getting the face in the fire, really squatting down and really close to those exposures. And the men tended to sit kind of far away and along a different side, and were getting a huge amount more ventilation. So that was a really interesting finding. Then we looked at kind of categorizing each of these minute-by-minute exposures. First, so as I said, the really high peaks, and all of the peaks pretty much happened during cooking. So whilst our experiences with going to the market and being around these really old, shoddy minibuses that seem to be spewing out all of this, that was not even registering compared to these other places. Same with the fires that were on the farms. That just didn't really figure. It's basically driven by cooking. And then when we looked at activity, which was cooking, versus baseline exposures, we found, interestingly, that you can see this median on the baseline on the top is actually really low. It was under 10, and the dotted line shows the WHO values. So actually, if the cooking had been cut out completely, that would be pretty good, actually. So it was absolutely driven by cooking. And then the important thing here is that all of these, they've got logarithmic scales. So actually, up here, the last notch is 1,000, which is just incredibly high exposures. And really the exposures, all the exposures during cooking were really high. When we looked at the baselines then, so that was when there wasn't any combustion activity happening, when there was no cooking, we split that up into daytime and nighttime exposures. And we saw again how much lower it was during the night. So there were, everyone in the village was cooking 3 times a day, essentially on a fire outside of the house largely. And that meant that there was a kind of baseline, and that dropped and dropped during the night. And you could see it kind of drop during the night and come up as people woke up and started cooking. Just one slide about the particulate matter and the carbon monoxide. Interestingly, when we looked at the different fuels that people use, we found that when people were cooking with firewood, which was the majority of cooking, that was linked to higher particulate concentrations. And we saw that and we felt it when you were cooking with firewood. It was clearly kind of was suffocating on it. And sometimes people went out when they could and bought little bags of charcoal and cooked with that. And it did feel a bit cleaner. It felt a bit easier. But actually, when we looked at carbon monoxide, the carbon monoxide concentrations were higher when people were cooking with charcoal compared with firewood. So that just showed that, you know, they were making one problem better, but then there were also issues. So all of this biomass cooking is massively problematic, obviously. Then we looked at fuel stoves. So we started off looking at fuel and then what stoves, but we figured out that actually people cooked in a combination of 3 ways. Firstly, what most people did was cooking with firewood on a 3-stone fire, which I didn't point out, but it was on an earlier slide. It is just 3 stones with wood stuck in the middle and lit. I must say here, it's called firewood, but it was sometimes other stuff as well. It was sometimes whatever you could find in the village, and it was bits of twigs, and it was someone's sandal or whatever. But it was generically firewood on a 3-stone fire. Some people had firewood cook stoves, not many, but some did. So some people cooked with a specialized kind of cook stove using firewood, and then some people had a charcoal cook stove and were able to cook with charcoal. And of these 3, when we used regression and we looked at the different combinations, the highest particulate matter exposures were associated with firewood cooking on a 3-stone fire, which was basically the generic cooking method for everyone because it's free. You don't have to look after anything or buy anything or go and get anything. So then we added in place of cooking to this model. So we had quite a good predictive model. We added in place and automatically it was a much better predictive model. And in terms of place of cooking, it got a bit complicated because we found that people were cooking broadly in one of these 5 setups. And number 1's indoors. Very few people cooked in the house, but some people had kitchens, they were called, which were separate little huts in the garden. And when I say indoors, that's defined in this model as 4 walls and a roof. So it was an enclosed space. So some people cooked in a full kitchen. Number 2 was also quite common though. So people had a kitchen, but the kitchen didn't have a roof, either because they stopped building when they got to that bit, or because the storm had blown the roof away, or because they'd run out of money at some point and taken the roof off either to sell it or to burn it in the fire. So some people had a quick kitchen, which was kind of, so that's again, not that ventilated, but a bit more ventilated than completely indoors. Then some people had verandas just in front of their houses. And some of these were walled with just a really short little kind of 2-foot tall wall around it. And some of them were completely unwalled. So then they just had their house and it was almost outside. And then the 5th one is obviously the most ventilation, where someone's just cooking in a yard away from the house. And we found something really, really interesting here. And when I first looked at the data without thinking about it, I thought, this is wrong. Why has this happened? And it's all gone wrong. And then I spoke to Henry and he said, of course this has happened. How can you not see? And what we found was that cooking indoors, in the kitchen or in the house, usually in the kitchen, was associated with significantly lower exposures than almost all of the other ones, which sounds a bit mad because it was being in there was horrendous. The smoke's in your eye, you can't see anything. But can anyone have a think about what the explanation of that might be? Not quite, because it's coming out of the fire. It was pretty horrible. But the exposures that we're picking up are lower, right? Were lower it when people were cooking in a kitchen. Yeah. Yeah, so the issue here is this is personal exposure monitoring. So whereas until recently, a lot of the studies have been putting something in the kitchen or by the fire, this was actually looking at what people were breathing in. And that's what happened. So to cook that and seamer stuff, it takes kind of 45 minutes to cook a meal. And the people who were cooking in the kitchen were going and lighting the fire and going out again, and then going when they had to and going out. So they were doing a lot of inning and outing and a lot of breathing in of fresh air, actually. Whereas when someone had a veranda, for example, they were sitting and their children were playing around the fire and they were sitting with their neighbours all around the fire. So it was just really interesting to have those insights and to think back what it's like and make sense of these slightly initially unexpected results. I'm not going to spend too much time on this, but essentially when we looked at the fine particulate matter compared with the carbon monoxide, we did find there was some correlation. But again, you can see this total clustering there of the background, so when people weren't cooking, and then a whole different scenario when people were cooking, and there was a stronger correlation between the two during cooking episodes or during combustion. Okay, so I'm not going to talk too deeply about ethnography today, but I think what's interesting to note is that me, like many others before me, have gone in and thought, okay, this is a thing, we're going to sort it out. I've got some solutions for people, they just need to cook outside or whatever the question is. And actually what we found when we did that kind of deeper work was that there's a much, there are much wider constraints and limitations in that setting that people are living under. So there's limitations on choice. People didn't really have a choice. They couldn't go and get a sandwich, so they were cooking 3 times a day in these long cooking episodes, because that was the most filling and the cheapest option for food, basically. If they had to cook, they had to use whatever they had for cook, which is sometimes damp wood, which is really smoky. There was daily hardship. So we were saying, well, is it not just apart from anything else really horrible to cook when it's smoky like that? But they were like, well, it's horrible to do a load of things that I do every day. Go figure. And then there was a precarity. This is very quickly, this is a picture of a kitchen that somebody spent a lot of time building up and saving up to make. And in December, we left to go back and then it's built this beautiful kitchen. And then we came back in January when we came back to the village, and it basically washed away in the floods. So I think that's a sense, there was a sense always of, if you talked about someone getting COPD when they get older, it's difficult to get someone to care about that when their priorities are about tomorrow and their kids and food. So yeah. Briefly, we did participatory work. We talked about this, or what can we do? What are the options? A lot of people talked about business, which is just about just get more money and it will be solved to an extent. So in the end, we came up with a really modest thing, which were these, which were firewood cook stoves. The great thing about these is that some people have them in the next village, and you can buy them in a few markets down, and they're 1,500 kwacha, which is 150. So if they worked, if people like them, they can just go and get them, and it wouldn't matter that we'd gone off home. We didn't expect a lot in terms of exposure levels. We know they were so incredibly high that getting these down would be really difficult. And then we did evaluation using really similar methods. We did a realist evaluation, and we did the same kinds of monitoring and observations. And we found, unsurprisingly, there was no significant difference in overall exposures or cooking related exposures but after the intervention. What was quite interesting was that we did see a small reduction in background exposures, so non-peak exposures. Any thoughts about why that might be?
Extinguishing fires, not to use.
Yeah, so there was a lot less of that smouldering fire stuff going on. People use the fire in the winter to keep warm as well, but with those, the ceramic stuff outside that it's made of gets warm, so you could extinguish the fire and the kids would sit on them. But you could, and it would still be warm, and they wouldn't just leave the fire going all day. You could start and stop it quite easily. So it was kind of good for that. Really importantly for us, it was really well received. It was really well used. So even months after, we were walking around and people were exclusively using these. They were like, we've thrown our stones away. And they were over there, so we could have gotten back pretty easily. Some people's things broke, but they had actually found wire and kind of bound it together again, which is awesome to see because it kind of means they liked it. They liked it partly because of the smoke, but mainly because they felt it was more efficient and it sped up the cooking, which is, I guess, also good. And we learned that actually it's important to do stuff that people find useful as well as stuff that fits our predefined objectives. This is additional work, what happened when it was COVID. Just to say that in conclusion, what I think we learned is the value of personal exposure monitoring and then this contextual data being there and knowing about what was going on. And we got loads of information from that. We found that cooking was absolutely, in this setting, the most important exposure. That's a contextual thing. Interestingly, like I said, firewood is linked to a PM 2.5, but charcoal, maybe other things. There were unexpected findings. It was really useful to know why, and that participant observation gave us that. The stoves made little difference. And there was this whole thing about researching with people and getting people involved versus researching people. So we're sitting down with our laptops and talking them through. It was great for that apart from anything else. So we had a lot of fun. And this is my cat who came from the village with me, and he always used to sit on the monitor bags because they smell of smoke. So I think they made him feel like home. So that's him. And that's me.
Okay, that's great. Interesting talk, and we welcome cat pictures at the RSS as well. Any questions from the audience? Yep.
Do you get a sense of what would make the biggest difference?
Yeah, absolutely. Yeah, absolutely. And I think you know some of the answers to this, but unsurprisingly, it's kind of wider structural stuff, I think, that's going to make a difference. So ideally, large scale electrification and not as a commodity, as a commodity, not as a product that's bought and sold in this context. And as a stepping stone to that, there's things like electricity mini grids that are sometimes helpful. And even in some contexts, LPG, which isn't an absolute solution, but is a stepping stone and can help with exposures, definitely.
So I was really struck when you said you categorized places and there were some kitchens that were open because they didn't have enough money to complete the building or there'd been some damage. There's no kind of actual intentional ventilation then, is it not something that's kind of considered in those communities?
Yeah, this is really interesting. Before I went out, we talked a lot about taking bricks in and out of various places to create ventilation. And if you saw in that half kitchen, there are little holes in the kitchen for ventilation. But if you're cooking in a kitchen like that, it's incredibly smoky. So those little holes in person, I can tell you, don't make much of a difference at all. The reason why people want kitchens and kitchens with roofs is because when it's really hot, you're not sat in front of a fire sweating for 45 minutes trying to make dinner. And I can guarantee it's horrible. It's horrible because it gets so hot. And also when it rains, your fire doesn't keep getting put out. And when it's windy, your fire doesn't, I was saying, well, why don't you just cook in the yard? But they were like, well, it's hard to light a fire when the wind keeps blowing. So it's all that protection from the element stuff as well.
Okay, one question. So PM 2.5 is known to be really unhealthy, and you observed really high levels as well. I was wondering also, would it be possible to observe, say, respiratory illness more in because it's mainly the women cooking? Could you observe that?
Yeah, absolutely. And there are people who are doing amazing work around that. So, and there are studies of cook stoves which have found, while they didn't find improvements in things like kind of longer term respiratory conditions or even pneumonias and things, they did find reductions in coughing or sneeze, you know, these respiratory things. Women were coughing all the time, and it was just kind of a normal thing in life, really. But we didn't look at that specifically.
Great. So we're going to take a 5-minute break, and then we'll resume with Craig's talk. Okay, so pleased to hand over to Craig for the final talk.
Thanks very much, and thank you to both the previous speakers who have, as you'll discover, probably saved me a lot of discussion on some of the things that I was going to talk about, which means I've got more time to talk about my particular interest. But yeah, as it was said in the introduction, I'm a senior lecturer in statistics at the University of Glasgow. But I think part of the reason that I'm maybe an interesting speaker here and was maybe invited along is that I'm also the Royal Statistical Society's William Guy lecturer for 2023-24, and I thought I'll talk a little bit about what that is and how it will actually, as you'll see, link into what I'm going to talk about today. So yeah, William Guy was a medical statistician and was one of the former presidents of the RSS, and since 1999, so for 25 years now, the RSS have been appointing William Guy lecturers as basically getting someone to go and speak to school children and try and inspire them about statistics. And it's something I've been quite passionate about throughout my career. And I was really lucky this year to be selected for secondary schools. And that's given me the opportunity, and I've had the chance to do that, to go and visit schools, to talk to them. And the theme this year was about climate change, and so it tied in really nicely to the research which I do, which is about air pollution. And so I'm going to talk, first of all, a little bit about some of the work that I do, and then we'll see in the second half how it actually, in terms of the theme of this, it ties in really nicely with schools. So I'm going to basically talk about how I think the role of going into schools to talk about air pollution actually has a dual benefit. It's not just about the sort of educational purposes of doing it, but there's kind of more to it than that. So this has already been covered kind of to an extent, but air pollution is a big problem generally, globally. And I think depending on where you look, but WHO, it's at least 9 out of 10 people in the world live in places where the pollution exceeds the guidelines. So I suspect Paul's talk would have been quite surprising to some people, but maybe less so when you look into this stuff, because most of us, wherever we live, are being exposed to air pollution that's above what we would expect, which is clearly not a good thing. And the example I've given here is the first city that I think I visited, which I really noticed this phenomenon, and I really noticed air pollution as a problem. I don't know if anyone knows where it is in the picture. It is Shanghai. So about 15 years ago nearly, 12, 13 years ago anyway, I went to Shanghai for a kind of undergraduate conference. And when I was there, it was the middle of summer. The sun was in the sky. So you knew it was sunny, but you couldn't see it. It was like so thick with pollution, with smoke. From what I gather, actually, China's made great strides in improving that, and it's not quite as bad as that nowadays. But nonetheless, it was the kind of first thing that brought me into thinking, well, like air pollution, you can't really see it here. We've talked about pollution. You walk around Liverpool or whatever, you probably don't know it's there, but you knew it was there when you were in China. But it is still a problem here in the UK as well. I have this is not her in the picture, but I've got a 3-year-old as well. And when I walk her to nursery, her head height is right at the height of the fumes coming out of cars. So you really think about it at that point. And lots of places around the UK have pollution levels exceed the legal limit. And we'll talk about how we know that, and we'll talk about how we can know more about it for individuals as well. But you can see as well a bit of discussion about that as well. Things like ultra low emission zones, low emission zones, all these different types of zones are being brought in to try and address that. But obviously more can be done. But how do we know where to put these zones? How do we know that, for example, Liverpool needs to have a low emission zone? Or how do we know that Glasgow, which is where I'm from, which has recently introduced one, how do we know that this is necessary? Well, we need to know what the pollution levels are. So it comes down to monitoring, obviously. I won't talk too long about this, but it's just to say that pollution comes from all sorts of different places, and they've already been discussed, cooking being a big one in certain places, and especially when you're using kind of biofuels. But factories, cars, towns, homes, they're the main ones in the UK. Again, in other parts of the world, things like volcanoes, wildfires can cause pollution, but we're really talking about a variety of different things. So when we talk about pollution, as has been touched on, we're talking about a variety of different gases, but we're also talking about the particulates that have been mentioned already, which are not really gases at all. They're just particles of dust, but when they find their way into your body, it's clearly not good for you. So how do we know about this? Well, this is where the monitoring stations come in. And around the UK, there are lots of these big fixed site air pollution monitoring stations. They're very expensive, they are very high quality, and they produce really good data. And you can see they're basically taking, I think on an hourly basis, most of them, they're taking a sample from the air, they're processing it within the machine, and they are transmitting basically data back centrally, which can be accessed. And that is one of the primary ways, and has been for 30 plus years, that the government has understood air quality around cities. And they're good, and they do a lot of good work in measuring a variety of pollutants, and they collect it real time, and that can be really interesting. And this is where we'll test whether the website will work for me or whether I have to rely on the backup map I've got. Is this going, am I going to need to reshare the screen to do this? Should be all good. So there's a nice interactive map which should show, if it works, and it is today, what the pollution levels look like on this particular set of monitored stations. And this is just one this is the automatic urban and rural ones that are being displayed. And the thing I found quite interesting, actually, when I looked last night, is that Central Liverpool doesn't actually have one of these, but it does have other ones. But so we can just look at one that's local. So we'll look here in Birkenhead, and it gives you everything. So you can look at hourly data. So you can see that the last measurement that's made its way on here is at 1 PM today. So quite up to date. And you can see graphs of what that data look like. So for example, we saw some graphs earlier from varieties of different places about what pollution looks like, and we see these spikes that often occur. They tend to come obviously weekdays when there are cars around, and at peak traffic hours. There are other reasons why other pollutants will appear at different times. But this is really good in that, in terms of us understanding pollution levels in these locations. So we have in this network, I think it's about 300. And what we actually see is a somewhat more positive picture, in the sense that everything's green there, that there are 10 levels of pollution, 10 being the worst and 1 being the best, quote unquote. And that tends to say, well, on a global scale, on the worst of the worst that you could get, the UK is not doing terribly. But as has already been addressed, not doing terribly on a global scale doesn't actually mean you're healthy. It just means you're maybe not as unhealthy as other places. But it is worth kind of pointing out, and especially at these times of day, because I do this talk at various different times of the day, and when I do the talk depends on what numbers appear. Because if I do this, I was in a school recently, and I think my talk was at 10 AM, so the 9 o'clock and 8 o'clock data showed up, and there was like some 5s and things all over the place. So it's time dependent. We're in the middle of the day, we're during the school holidays as well, so pollution is probably going to be a wee bit lower at the moment. But we can see these nice maps, and you can actually get even, if we go back in, I'll just pick, it's Wrexham this time. I actually can show you what the site looks like and exactly where it is. And that's really useful for a statistician, because we know exactly what our data is going to be. So that's a really good thing for us to be able to know. It's good for us to understand where these data come from. And I've got my emergency map in case it didn't work. And you can see that on my emergency map that happened to have been taken, obviously, at a different time. We actually have a 5 in central London there. And we have, I think it's in Port Talbot in Wales, which is a heavily industrial place. We have the 4 there, but that will change from time to time. But we do have a problem that arises from this. And this has been touched on earlier, and it's been touched on with things like the imperial model that we've spoken about. What that is given is the pollution level at the site that we're standing at. It doesn't tell us much about what's going on elsewhere. So, for example, if we look on the map at Glasgow, and we look on the map at the one somewhat south of Glasgow, which is Dumfries, this is actually the area in the southwest of Scotland where I grew up. I think quite nice there. We talked about being by the sea doesn't mean everything, but it's also generally a bit more rural. Small towns rather than big cities. So the air quality is probably quite good. But we don't really know that from these monitors because we don't have any. There's nothing there. So what do we do? And traditionally, you could use statistical techniques, and we'll talk about that. We can take a weighted average from the nearest locations, and this is a statistical technique known as kriging. Some people will be familiar with this. I'm not planning to go in depth about how this works statistically, but I will always try and include an equation. It's essentially a weighted average of the observed data from the sites that do have them. So if I wanted to know what the pollution level was like in my hometown, then I would need to say, well, what are the pollution levels at the various fixed sites that are nearby? And nearby can be stretched, because nearby for me is still probably 30 or 40 miles away. It's not on my doorstep by any means, but we can take a weighted average of those observations. But where do the weights come from? So that's where these weights can be estimated in a number of different ways, but typically what we tend to think about is that they can be estimated proportional to the distance between the observed and new locations. Kind of makes sense. If you're much nearer, if you've got a monitoring station that's quite near you, you would expect to some degree that your pollution level is going to be more influenced by that. For example, if we're here in Liverpool, and I should say there wasn't one in central Liverpool, you'd expect that one across the water in Birkenhead or the one in Tranmere to be more similar than one in London. So a weight, you would expect higher weight to be given to the local ones. Now, there's much more to the modelling than this. I've kind of tried to oversimplify it. There will be population level effects, there'll be urban-rural effects, there'll be things to do with traffic, etc. But that's the kind of simplistic approach. And what that means is that the predictions of air quality will be better in areas where we have lots of monitoring stations, and we will be poorer in areas where we don't have any monitoring stations nearby, because we're relying on data that's further and further away. So we've just got less certainty about the quality of our estimates. But we can produce nice maps like this, which show pollution across the UK. And I suspect this is not the type of map that Paul would have been talking about earlier, because they will be more sophisticated in a way that we'll get onto. But we can use those monitoring stations to just produce maps like this using approaches such as kriging. You can fit a nice grid of locations across the UK and say, well, using this kriging approach, what does the pollution look like? May end up with something like that. Nothing surprising will really show up from these, because you're going to see the highest pollution in the biggest cities, especially in London, where the most people live, etc. And that's all useful, and it's certainly, I think, the rudimentary and initial way that people started to think about air pollution. It's how the science probably develops in terms of the monitoring and modelling, but we can do better now. And that's where I think the modern stuff will come in, because these monitoring stations are really expensive and therefore we don't have lots of them. But we now have a plethora of smaller, cheaper models. They've been talked about in Sepeedeh's talk about the ones that are carried about portable. You get fixed site ones that are smaller and cheaper as well. But the point is, there are loads of these all over the place now, and we can use these to help influence our modelling. They increase the coverage of our air pollution monitoring substantially. So now, instead of, for example, the town in Ayrshire where I grew up not having any monitors, perhaps people have got them in their back garden or in their house. Some cities are putting them on buses. There are all sorts of ways that these smaller monitors are now occurring. So instead of just having 300 fixed sites, we've now got loads and loads and loads, and I mean loads and loads of monitors to help. The downside is that clearly, as comes with the territory of being cheaper, they're also much less accurate. That's the trade-off we've got. We can get them into places, but they're never going to be as accurate as these big expensive stations. If they were as accurate as the big expensive stations, then the big expensive stations wouldn't be there. But we've got this trade-off here. And the statistical problem that I tackle, and I'm not going to actually spend too much time talking about it today, so I think it's actually secondary to what I'd like to talk about. It's just to say the statistical problem that we have here is how to combine these two or three or four, depending on the number of types of portable monitors that you have, but these different sources of data, where you've got the really frequent low quality data and the infrequent much higher quality data. How do you combine them together to get good localized estimates? Because if you've got a small portable monitor right next to a big monitor, the big monitor is going to be more right. But if you're comparing an estimate from just the big monitors when you're 30 miles away from the big monitor, your portable monitor is probably still going to do better. And this technique more broadly in statistics is called data fusion. There's lots of other names given to it. That's the name that we kind of use in our group, I think, and it's got some legs anyway, but there's lots of things you can do with this, and there's lots of work that can be done and has been done on the implications on health and the fact that you can improve your estimates of health effects based on using this more localized data. So there's loads of benefits to doing this. And what I want to talk about is a kind of less thought about benefit. So when we're talking about the benefits, we're thinking about the benefits to our research-based understanding of what is the level of pollution and how does it relate to health. But it's not actually the only way that we can benefit. So just to give an example here of these smaller stations, this is something that I found out about from the University of Edinburgh, and they have developed this as part of a schools education process, or project, a network of portable monitors across the east of Scotland. And I think there's about 600 monitors just across that part of the east of Scotland. So we now have a situation where just on one network in one part of Scotland, we now have twice as many monitors as we had in that Environment Agency network. They're much poorer quality, of course, but they are still much more localised. And they're in schools, they're in community centres, and this was set up, I got told this as part of the story, that it got set up and there were kids involved in the creation of the network, and they were involved in the discussion, which is a good thing that we'll get onto. But they were saying, well, we've talked about human health, but what about animals? Are they not also affected by, they've still got lungs, they're still breathing this bad air. Are they being affected? So they decided they would also install a portable monitor within, I think, a wildlife park or a zoo. So we've got all of these different monitors, but you can imagine the effect that will have on being able to estimate pollution across that region of the east of Scotland, rather than maybe relying on 4, 5, 6, 7 monitors in Edinburgh, maybe one in Dunfermline, maybe one in St Andrews or something like that, and maybe the ones in Dundee. You've now got them all across towns and villages in that part of the country. That local community can access that data in real time. They can immediately see what is the pollution like in my town, and it's not what is the pollution like in the town 20 miles away, and then we have to fit a statistical model to work out what it might be in our area. It is, here is the real-time data, here are the changes, here are the peaks and troughs, and they can start to think about what's causing that. And I think that's very much like the data we saw earlier in terms of the cooking exposure. You can understand if this is in your town, you'll be like, oh, well, yeah, it's happening where I live at the moment. There's a diversion, there's a roundabout closed, people are driving through, like, my village, if we want to call it that, where I live, that wouldn't normally be, and I'm sure there would be these peaks. And you'll be able to point to that on your local monitor and say, suddenly we've got these peaks. So understanding data, it's a kind of democratization of data, almost. So yeah, there's multiple benefits of having these. I've already talked about the statistical modelling benefits, but I wanted to kind of address something that's occurred to me as I've been doing these William Guy lectures as I've been visiting schools. Because the monitors are helping improve researchers' understanding of pollution, which is potentially part of why they were there. But there's an equally important role, which is that these monitors kind of belong to the local community. They're in the community, they're in schools, they're in community hubs, they're in other places like that. And it makes that community also feel part of the monitoring and modelling process. They understand, as I talked about, here's a peak. They think about why that's happening. You're turning them into scientists, you're turning them into researchers, you're turning them into people who are engaging with the data. And for me, as someone whose role has been, and this wasn't how I envisaged it, this is, I think, the good thing with the kind of lecture that I've been doing in schools, it's evolved over the year from, there's a video on the RSS website, which was the talk which I probably recorded about 9-10 months ago, which was the original version of my talk. But now when I go into a school, I'm probably doing a slightly different version, because one of the times I did a talk, one of the teachers said, oh, we've got one of those monitors in our classroom. And I hadn't thought about this, but of course, during COVID or after COVID, when schools were coming back in, they started putting as standard in a lot of council areas, carbon dioxide monitors in classrooms so that they could assess air quality, air circulation, mainly from a disease prevention point of view, but these are remaining in the classrooms and they're telling the teachers and the students indeed, when have they got high CO2 levels. So as soon as one of the teachers said that to me, that triggered something, because that is a really good educational tool for me, because I can go in and rather than me having to talk, and I still do talk about these pollution stations, I can say, have you got one of these in your classroom? Have you noticed anything with it? What's going on? And I was actually in a school in Oxfordshire about 3 or 4 weeks ago, and they actually had been doing a project with some secondary school kids on actually modelling the data from their own classroom. And that is what will bring people into our subject. It's what will bring people into being statisticians, which is technically what the William Guy lecturer role that I'm doing is. But more importantly than that, it's going to bring them into being kind of climate scientists. It's going to get people asking the type of questions I think like Paul wanted them to ask as well. Is my air safe that I breathe? So these are not just helping our understanding of the monitoring, they're also helping bring people, and they're helping as an engagement tool. And I think that's kind of absolutely crucial. There are some exceptions to that rule. This is where I live, and I went on Sunday to a cafe around the corner from there. And this is one of the large air pollution. This is a Scottish government one rather than one of the Environment Agency ones. But in the background there is the primary school. So that primary school probably doesn't benefit from having portable monitors outside because they've got one of the big fancy monitors literally on their doorstep. So if I went in to give a talk there, I might not have the same impact as when I go into give a talk somewhere that are 30 or 40 miles away from the local monitor. But the point is that air pollution and air quality will be much better understood by people when they see how it affects them directly and individually, which is more or less the exact same theme of both the previous talks, as I said. So yeah, to round up kind of what I wanted to talk about, these fixed site monitors are really producing really high quality data, but they're fairly low density. It has a downside of not being able to model as well in regions that they're not in, but also has the downside from a kind of campaigning or a educational point of view of people seeing it as being quite distant and detached. Okay, I'm in Colwyn, the town I'm from, and I go into school there. They're like, well, that station's in Glasgow, that's miles away from me. So what? Whereas if we have one in their classroom, it might not be as good quality, but it fills in all those gaps in the models, and it also fills in the gap in terms of their understanding of how it might actually affect them. And because they're monitored and often operated within these local communities, there's much more access to data, there's much more democracy to it, and they can be a useful tool from an educational point of view as well. So yeah, I think, and I'll leave it with one of Scotland's kind of greatest exports, which was John Muir, who ended up setting up the national parks in the USA. But my talk was probably a little bit briefer than it would have been because a lot of the introductory work was very kindly done in the other two talks, and there's no point in me covering old ground. But I'd hope that you found some of that useful, and I'd really welcome any questions that people might have. And thanks again for inviting me to come and speak to you.
Yeah, thanks, Craig. It's a great talk. Any questions?
Do you have a sense of how local you need to go to get a really good impression? Because this is the thing I'm struggling with at the moment is why, although my house is in a very highly polluted postcode, my actual house doesn't appear to be as bad as I thought, whereas a few hundred meters away. So yeah, do you have any feel for like how hyper local do we need to go? Does it even matter?
I think it's a really good question. It probably varies from place to place. I think, I mean, in the ideal world, you probably have, from a statistical point of view, it's a sampling problem, and the bigger the sample you have, the better your estimation. So of course, it would be great if every house had one in every room because you'd be straight in there. But I think essentially every single time we add one to the network, we're going to improve the quality of the estimation. But I think it's really interesting that you do see these effects. I live right next door to the primary school, and it's always been something that I've wanted to get one of. I've not got around to it yet, but to get one of these to really see, well, because my daughter will be going to that primary school, so it'd be good. I mean, she lives there as well, so I suppose she's getting that pollution level all the time. But to understand what is she breathing on a daily basis would be really useful. But as for whether having one 100 meters or 300 meters down the road would be good enough, you would hope it'd be better than what was already there. But I think you do run the risk of these kind of localized things. So I think even stuff like hills and whether you have trees around and things like that can really on a very local level affect it. I would not claim to be a kind of pollution scientist in terms of understanding how things move through the air, but I think it's the more the better in general, but that will become more frequent as these become even cheaper. They're cheap now, but they get cheaper.
So yeah, obviously, yeah, the more data you can have can have for this, the better. Do you know if there are any kind of like, I guess like citizen scientist type attempts to try and pull all of this data from all, anyone who's wandering around with a, literally handheld portable air monitor who might have, a couple of hours every week to spare to just go and like, stand every 100 yards and take a reading sort of thing. Is there any efforts in the way to try and pull that data from just like volunteers all around the country who might want to contribute to this or that you know of for?
Yeah, it's a great question. It's kind of part of what I'm starting to try and think about, because I've talked about having all these sources of data, and these are networks that I've found out about when I've been attending talks. I don't have that data. I know that data would be really useful if it was available to research. There are a number of reasons why people aren't just going to hand it to you. There's a number of security, privacy concerns that will have to be addressed first. But I think, yeah, one of the crucial aspects, and it's part of why I actually come and I'm keen to do these talks and to talk about it, is you understand how many, like find out about more of these, and you do want to understand, and it's things that I've been trying to do, speak to people and see what would it take for researchers to be able to get access to some of that data, because yeah, you're right. The only way that can be used to its full potential is if we can get all of it kind of under one roof. And there are people who are doing exactly what you described, which is collecting it, especially in bigger cities, because there's societal benefits, and you're seeing kind of legal action and legal cases now on people who are being able to correctly claim that they are being, their health is being affected by air quality. So having a way of actually bringing this data into the bigger models would be fantastic. And I think it's just getting that ability to pull everyone together. So as of yet, no, but it's something that I'm quite keen to do in particular.
So we have a couple of questions online. So the first one is, could you please give us a brief summary of the data fusion methods that you used?
Yeah, so thanks for that. So I didn't put it on the slides deliberately because I thought it might bore people. It's probably just in terms of you've got it's essentially there's a number of things that you have to take into account. So each of these stations, the fixed stations, will be measuring multiple pollutants. So we actually have information about the relationships between pollutants. So for example, if we know the CO2 level at a station and we're also measuring the PM 2.5, let's say, we can start to establish the correlation that exists between these. So then if we have either a smaller station or a portable monitor that only measures CO2, we can use that correlation to also make a prediction of sorts on the PM 2.5 without actually having that modeled. But every time we bring in one of these extra monitors, we have to account for the vast difference in variance that's associated with that. So what we end up doing is assigning different weights to each monitor based on the quality of the data that's being assigned from it, but also based on distance. So if I want to measure it here, if there's a monitor just over there in this room, it's going to get a really high score in terms of distance. But if it's a really poor monitor or it's not actually modeling the pollutant that we're interested in, it doesn't mean it's completely useless to us, but its contribution might not be as high to the overall model as we could get. There's loads of papers on this that would go into it in a lot more depth, and I don't want to talk about it without slides. I'll just say something wrong. But yeah, that's the kind of basic idea. It's about understanding the different variances in the different sources of data and trying to do essentially a big weighted average, but obviously in a bit of more nuanced way. You can use Bayesian methods, or you can use techniques such as that to really pull together all this information into a single model. It's essentially about joining multiple data sets into a single kind of statistical model, which can also then be used for prediction and also for measuring relationship with health and things like that.
So we had another one about the how you can find the weighted mean using the distance to areas when there's no station installed. But I think you essentially just covered that, right? It's essentially the same sort of method as the raw Cregen. Yeah. And we got another one about the Cregen. So do the Cregen methods take into account things like wind direction and strength?
Yeah, so that's a really good question. There are models that take into account. So I was just talking more. That was a kind of general explanation of what Cregen is and how it works. But when you have things like that, you can introduce atmospheric models that will think about things like airflow. If you're in cities, you get these kind of, like if you're on busy streets, especially if you've got higher buildings, you get these kind of funnels that are tunnels almost of air that come down, and you can start. And there are people, I've not done it myself, but there are people who can model things like that in terms of the airflow, in terms of the physics of it. It's probably more of a physics problem than a statistics one at that point. But yeah, these models can take in whatever you think into them. That's a very base level model, and that's just kind of ordinary kriging without any other parameters. But there's lots of different types that can take into account. As I say, you might use things like even urban rural classifications, population, distances to roads, distances to green space. There are lots of things that you could include, and things like wind speed and wind direction, temperature, are all potentially can be incorporated, in the ones that are used, you know, to actually do the prediction will incorporate what they have access to. So that's my phone over on the other side of the room. Yeah, we'll have to go in a minute, but that's sorry. Yeah, is there any more questions? Thanks very much, everyone.
Great. Let's thank all three speakers. And thanks for being here, and thank you also to the YouTube audience, and hope to see you at our future events.